Welcome back to another episode of the Patient No Longer podcast. We've got a returning guest today, and we're going to be revisiting a topic that we covered previously on the Patient No Longer podcast. But first, I want to say hello and thank Chris Bevolo for being on the show.
Thanks, Ryan. Great to be here.
Well, it's great to have you here. I know you well, but of course, we've got some listeners, maybe a few listeners that don't know you well, although you're very well known in healthcare and healthcare marketing. But for those who don't, Chris has provided leadership and guidance in the areas of strategy, brand, marketing, digital, and change management to hospitals and health systems across the country for more than 20 years. Chris is an award-winning author of 6 books, including Joe Public Doesn't Care About Your Hospital. Still such a great title, which became a field guide for driving transformation in hospital marketing departments across the country. His latest book is Joe Public 2030, which makes 5 bold predictions about consumer healthcare for this decade. Chris is a frequent keynote speaker and featured presenter on healthcare marketing and branding topics. He also has a podcast that I've been on, but you've now been on this podcast multiple times. You are a repeat guest on a repeat topic. I can't believe we have you.
I'm not sure if that sounds great or not.
I did use
Welcome
the word.
to the Rehash podcast.
Well, time has passed, as it often
It
does.
has. It does pass.
The passage of time. And we had you on initially at the release of the book, which was looking almost a decade out at what would be happening in 2030. And time tells me we are a little closer to 2030.
We're almost halfway there.
We're almost halfway there. And there's some bold predictions
There are.
in this particular narrative that we want to revisit today.
See how we're doing. See if our predictions are on track.
So it is in some ways something old, but something very new.
It is. Yes, it is.
I've convinced at least you, maybe not the listeners. But I want to dig right in because I love this book. I read it from cover to cover when it came out. Obviously, the whole Joe Public legacy has been fantastic over the past decade plus. But you are not afraid to put a stake in the ground. And maybe you could first, before we dig into the 5 topics, just give everyone who's uninitiated a little bit of the flavor of what the Joe Public approach is about.
Sure. So the Joe Public approach really started with that first book that you mentioned, Joe Public Doesn't Care About Your Hospital, which came out in 2011, which was really all about how we need to change desperately our approach to marketing and branding and all the things for hospitals and health systems. Right. You know, it's been a long time, and unfortunately, some of the book is still relevant, which is good and bad. But since then, there's been a couple other books. One that focused more on digital and content marketing, same kind of spirit. The third one really kind of checked in to show the progress that the industry had made. Back then, we used to say that health systems were maybe a decade behind other industries in marketing and branding and all of that. I think by Joe Public 3, which came out in 2018, we had shaved that down to 3 or 5 years, and in some cases had caught up or even passed some industries, particularly in areas like content marketing. So the latest book, Joe Public 2030, really doesn't touch any of that at all, Ryan. It has nothing to do with marketing or branding. That's how we started the book, but we ended up in a place that was all about how consumers are going to engage in healthcare, which is much bigger and broader, and depending on who you are, maybe more interesting.
Maybe more interesting, and I think still very applicable to marketing. But we have lots of listeners who are in the patient experience and other parts of healthcare, and there's some nice, really broad industry predictions out there that I think everyone will enjoy. So I will recap each one of the 5.
Okay.
And you tell me where we're at, if it still exists, if it disappeared, or if we're right back where we were when you wrote the book a few years ago, which healthcare can sometimes do.
Yes.
The first bold prediction is the Copernican consumer. So this states that consumers will become the center of their own health universe more than ever before, enabled by AI and other technology, as well as services geared toward empowering them, leading to profound implications for both consumers and healthcare organizations. Potential results could include a dramatic reduction in the need for primary care clinicians, an entirely new sector devoted to personal health management, and more. So where are we at with the Copernican consumer?
Well, just to put everything in perspective, these were all kind of locked in almost exactly 3 years ago. So we're 3 years away from when we put these together. Right. This is the one of the 5 that's going to sound like maybe a bit of a duh. It's probably the safest of the 5 to start with. That's why you started with it.
Sure.
And honestly, it goes beyond what I think we all know about in terms of patient centricity. This is really about a complete paradigm shift in how healthcare is delivered, how value is delivered. It includes everything like in-home healthcare, digital healthcare, AI-driven healthcare, all of that. It goes really deep and it gets really wonky, and we're right on target for that. We're moving forward. It's a little bit of like we speed up and then we slow down again, and we speed up and we slow down again. I think home healthcare and hospital and home was really getting momentum, particularly after COVID. And now I think it's slowing down a little bit. I think it's, of course, difficult to pull off, but it is almost certainly the future of everything coming to the consumer wherever she is at, which is most likely her home, her place of work, out in the town. It is less and less going to be in facilities of care as we typically think of them.
Okay, so not as restricted to the halls of care, which is a lot. I think a lot of healthcare people think about it that way.
Right.
I think it's still a little unfamiliar for them to picture someone out in the community living their lives and possibly receiving healthcare.
That's right. That's right.
So that one was easy because it's progressing in those 3 years.
And it's
We'll
also
see where
maybe
it goes.
seems the most familiar to people. That should seem very familiar at this point to everybody, that that's moving in the direction it is.
I would certainly hope so. Okay, well, we're staying on consumer a bit for the second prediction.
Yes.
Seeing where we go here. This is the constricted consumer. So while consumers will become increasingly responsible for their own health and use of healthcare services, they will actually become less and less empowered in the choices they have for care, especially in higher acuity, higher cost situations. While many in the industry will continue to sing the praises of choice, the reality is most consumers will have far fewer choices moving forward, often in ways they might never even consider or see.
Yes. So this is particularly focused on hospital care, higher acuity care, like you read.
Yeah.
And really what this is folks, so this is experts we talked to, research we did, saying that consumerism is a bunch of bleep.
Yeah.
It really is. It's been with us for like 20 years. It has not come close to driving the change that people thought it would drive. And this prediction is about how not only will that continue in terms of kind of innocuous impact, it's going to get worse for the patient in terms of the idea of consumerism is supposed to be, hey, we're individuals. If we had more information, if we had more access, and we're spending our own money, we'd be able to drive the change we want in this market. Not happening. And this is really, this has continued to move forward in the way we unfortunately thought it might, because what we're seeing is folks becoming more and more restricted in all the ways you can think of. So a great way to focus on this is to think about payers, health plans, who continue to steer and tier and prior authorize and prevent care happening in all the ways that they do. That's an example of how it's very difficult for consumers to get the care they need. The idea that we have something called a PBM, pharmacy benefits manager, which if this was really an industry that was being driven by the best interests of, or for the best efforts of patients and consumers, that would not exist. That is a black box business delivery system that is a money-making machine for health plans and has no other benefit on the face of this earth. So that definitely would not happen if consumerism was doing what it was supposed to do. So unfortunately, constricted consumer is really moving forward in a negative way, which is what we predicted.
So help me at this point, just taking stock in what you've already said. We have the Copernican consumer and the constricted consumer. I think this also taps into a certain tension that you see in the industry about, on the one hand, consumers are empowered and they can do whatever they want. You kind of alluded to that already, but it is still very true. You'll see a new innovation come out, or a health system, or someone announces something, and they'll talk about people can choose this and it's a wonderful future. And then we talk about the constriction they face. I mean, the fact that on some of those wonderful exchanges that we're supposed to have lots of options have one plan, or the plan has all the control over you, or it turns out that bronze plan is really beep, to use that phrasing. And so sometimes I feel, a real back and forth there. What do you make sense of that? Are we being gaslit by people saying the consumer's empowered?
Well, yes,
are we,
Ryan?
Yes.
We're being so gaslit. Think of the term consumer-driven healthcare.
Yeah.
We all know where that came from. That came from insurance companies back in the 90s. Consumer-driven healthcare means we pay more and more deductibles,
The
higher
skin in the
deductibles.
game.
Yes, skin in the game. That's what we all want as consumers, right? We want to pay $20,000 out of pocket. That sounds awesome. So that is the biggest gaslighting that you
Sign
can
me up.
imagine. There's a really interesting trend that we call out in this prediction that we learned from experts we talked to, where there was a ruling in 2019 around federal taxation and how, employee benefits, health insurance benefits are tax, preferred for companies, which is a big reason why they keep them.
Right.
But the ruling said, like, hey, you don't have to just offer benefits. You can just give people a bucket of cash that is designated to go out on the market and spend it for insurance. And that also would give you that tax benefit. So we're seeing slowly but surely companies move toward that. So now imagine that if you're one of many people who are commercially insured, we call them,
Sure.
right? You get your health insurance through your employer, that now instead of getting, a couple plan options through your employer, you're given $10,000 to go out in the market and fend for yourself.
Yeah.
So that's an example, again, of something that hasn't really hit any kind of tipping point, but there's no reason it won't. It's very similar in ways to how we moved away from the typical pension to a 401k.
Right.
And look where we're at with retirement savings in this country. It's very similar. So that's another example of where it's going to be sold to us as freedom.
Right.
Hey, Ryan, freedom to choose whatever plan you want. And then I'll just end by saying my dad, when he was with us, I helped him, he was like 80, and I helped him pick from his Medicare Advantage plans because he had 22 to pick from.
Okay.
Freedom of 22 plans.
Wow.
3 of them were viable, and really only 1 was affordable. So even though there was 22 he could pick from, only 3 covered the physicians and the care that he already was receiving, and only 1 was really affordable.
It's not a choice any longer.
Yeah, it's 22 choices, just only
Right.
1 counted. So that one unfortunately is at the level 10 in terms of coming true.
So we're 2 predictions in, and I'm already a little bit sad. So
Well, these are the first one is not supposed to make you sad. It should make you happy.
Well, I'm just going through the interview with
It's
the
only gonna
emotions
get
that I
worse,
feel.
Brian.
Well, then let me do the transition because we try to keep it light at certain points.
Okay.
So I'm going to hit you with a speed round.
Wow. Out of the blue. All right, let's go.
So you don't know the answers. You don't know the answers to these. You have the answers.
We'll see if I do.
You're an empowered interviewee.
This is a lot of pressure.
So these are fast. Don't overthink them. I'm asking every guest this season these questions.
Okay.
Dogs or cats?
Both. We have both, so both.
Okay. Yeah. You don't want to offend any of your
No.
pets. Got it. Beach or mountains?
Oh, mountains.
Okay. Morning person or a night person?
Both.
Okay. Not getting enough sleep. Favorite television show of all time?
Oh, boy. I'm going to say right now Succession.
Succession.
It
Okay.
took over from The Sopranos.
Okay. Hey, you had a couple answers. Some people really struggle with that.
Oh, I have my top 5 if you want to go through them all.
Hit it.
Breaking Bad's in there, The Leftovers is in there, and The Wire. I think that's 5.
True Detective season 1.
True Detective season 1's in the top 10.
Okay. Well, that coexists with a guest who gave that as the number 1. This is nice. See, this is a little bit of humanity. San Diego or Los Angeles?
Oh, well, we're in San Diego, so I have to say San Diego.
That's up to you. You're
If I don't
empowered.
have to say it, then I'd say LA.
Okay. I think we note that as LA is the answer.
Okay.
Okay, so that was a bit of levity. Let's dig back in. We have 3 more predictions to check up on. The next is the funnel wars. We tend to consider hospitals and health systems as birds of the same feather in terms of business model. Moving forward, we could see the splitting of the health system model, with some systems moving even further into the larger, more comprehensive, quote unquote, health organizations, others retracting into solely acute care destinations, and maybe others somewhere in the middle. The primary area where this would play out is with health, wellness, and the lower acuity care points, what we call the funnel wars.
Yes.
How are the wars progressing?
Well, it's very interesting because the wars were really not going well for traditional health systems. So this is basically the wars are pitting traditional health systems versus all the disruptors, the tech companies, the retail companies, the Amazons, the Apples, the Walmarts, the Walgreens,
Right.
the Teladocs, all of them in a race for the top of the funnel, primary care health, all the things you read, right?
Right.
And up until I would say this year, it was just every quarter we look at it, and something like, Dollar General gets into it. There's there's a gas station chain in the upper Midwest called Quick Shop,
Sure, I've been
which
there.
actually started offering some forms of care in their gas station. So you're like, wow, we've hit the
It's
point, right?
quick.
So if we were doing this even back in November, December, we might have said this is right on target with what we said, which is this level of incursion by these disruptors is really going to change the whole idea of health systems and what they could be. And some are going to have to retract to what hospitals used to be, 100 years ago, which is basically just a building for inpatient care.
Right.
And since then, these folks have been falling over left and right.
Right.
I mean, it's hard for me to even remember all of them that have pulled back. Walmart's pulled back. Walgreens is now going to sell Village MD.
Right.
Teladoc and Amwell are just in the toilet in terms of finances. Even Optum
Yes.
shut down their virtual care, which is like, astounding. So a lot of these folks who were seen as the leaders in this have just collapsed. And you and I kind of joked about this before. You can kind of hear the laughter in the C-suite halls of traditional hospitals and health systems who are saying, "How I told you so. We knew you guys could never hack it." Apple's still out there. Amazon's still out there.
Right, they
CVS is still
retool.
out there.
Right.
So they're not going away. But whether we see this level of disruption by 2030 is now very much an open question. And it is probably the prediction that it has gone backwards from being dead on to probably not sure. Not sure if this is going to pan out.
Downgraded to not sure since
It's
the
been
release of the
downgraded.
book.
That's right.
But do you also think that the Amazons in the world and others, are they really going to say, nope, I'm out for good? I'm never going to try to get back into healthcare. I realize they're scuttling certain programs or retooling them.
Mm-hmm.
But is your sense that they're going to come back in, a lot of those huge, massive companies and brands, to healthcare?
Well, yes, I think like an Amazon, Amazon has opened and shut, I don't know how many versions of the virtual care, but that's their MO.
Right.
Right. And they were also part of Haven. Was it Haven?
Yes, it was Haven.
Right? They got to
Yes.
dust that off.
Berkshire Hathaway,
with
JP Morgan.
That's right.
Yep.
Which also, was supposed to transform healthcare and then failed. But Amazon's MO is to do that kind of thing. And
Yes.
and part of what you learn when you dig into this is these organizations are so big. There's very few places for them to point. Like Apple's got like $250 billion in cash, just piles of money. There's very few places for them to point all of that capital and continue to grow. And healthcare is, as we know, the largest sector of our economy by far. So it seems like they're just going to keep coming and trying. And the folks that have the patience and go out the right way, which maybe Amazon's doing, maybe Apple's doing, we'll see, may come out and actually have an impact. But as they keep falling down, the pressure comes off the traditional health systems, which isn't necessarily a good thing.
Right.
Because part of this was hopefully this would drive them to actually adopt some of the things for consumerism that we were hoping would come and show up in a better way. And now they just can sit back and go, we don't have to change it all.
Yeah, at the very least, decreases their sense of urgency, or maybe they
pressure. That's right.
Some of their own projects altogether.
That's right.
Okay, let's go to the next one, and this is a really interesting one. And we are in an election year, so
we're always in an election year. It feels like
every year is election year. Rise of the health sects. So this is the challenges to the mainstream medical field that have exploded because of the pandemic and political tribalism in the US. This distrust of experts eventually could result in multiple health sects, primary schools of medical thought that coalesce around political or worldviews. These sects will not only follow the medical thinking that best fits their worldview, they may create their own reality through alternative research, diagnosis and treatment, and models for the delivery of care.
Yes. This is the prediction that's already happened.
Okay.
Because we went as far as saying this, because we all know about tribalism and the politicization of like everything, the music,
Yes.
the clothes you wear,
Feels all divided.
the car you drive, all of that. So why not healthcare? And we've already seen it like it's a political football in so many ways. And so our prediction was we are going to see the emergence of a business or businesses, multiple, that will deliver care explicitly through a political worldview to go after that audience that they're aligned with.
That's their target audience.
That is their target audience, right? So it's kind of like MSNBC targeting people on the left with news because that's their audience, right? So we have seen this start in Florida with something called the medical freedom movement, which is essentially what we put in the book, which is an outcropping of a lot of the pushback on what I would call, you can call it mainstream medicine, like, hey, wear a mask. Hey, take the vaccine. We all know about the pushback on that. And so now there's a movement called medical freedom where there's an organization that is actually trying to build clinics to deliver care through this lens of medical freedom to appeal to that audience that believes strongly in those political / healthcare points of view.
And medical freedom sounds kind of good. So what do they mean by that? Like
medical, does it sound good? Ask doctors
I don't know.
Hey, Ryan, medical freedom means you can do whatever you want to do with your health.
Oh, well.
If you don't want to vaccinate your kids,
oh,
don't
I
bother.
See. Okay, so
because you're free to do whatever you want to do.
There's the rub. The freedom would include not following certain guidelines. Or
following whatever guidelines that kind of mindset believes. And we're seeing it emerge on the right, and that's really where we heard the most. And again, this isn't about right or left necessarily. We saw the most blowback from the right side of the political spectrum. Sure. But there could be something on the far left that it's more, call it like a progressive point of view that's more holistic medicine, also rejecting kind of mainstream healthcare of surgery and drugs and all that kind of thing. So it's not necessarily one or the other, but we are seeing it come forward more from the right side of the political view in this Florida example. So there are other examples. There are counties throughout the country where folks have started alternative health boards.
Okay.
You got the county health board. They don't like what they're saying, so they're going to create their own health board.
Okay.
Yeah. So it is real, and it's already, that one I would say check, done. I don't know if we're going to come back from that.
Didn't need to wait till 2030 to see that.
Unfortunately, no.
To be sad.
It's probably not a good thing.
Yeah.
I don't think, but it is happening.
I see. I can see where I was supposed to focus on the positivity of the first one.
That's right. See, and wait till you get to the last one.
Really? Yeah. Well,
the last one is like, there's no hope.
I don't know if we should do this to our listeners, but we said 5, we've only done 4. So let's move on to the really pleasantly titled Dystopia.
Disparity Dystopia, yes.
And this is a very serious issue. It's very dramatically worded, but it's something that I'm very interested to hear your response on where we're at. Because the pandemic shone an ugly light on the disparities that have plagued the U.S. healthcare system for decades. Unfortunately, that gap is more likely than not to expand as the haves gain access to increasingly more expensive health services and personalized care, while the have-nots will face growing shortages of basic health resources. All the while, those entities that might address these disparities struggle financially, and others lack the incentives to focus on the growing issue.
Yes.
Where do we stand? Are we already a dystopia?
Well, what's interesting is, we wrote this in 2021. So after we're done with COVID,
right?
Turns out
we're emerging.
I think we're in the second largest wave of COVID right now. Did I have that right?
I don't know.
So we're really not out of COVID, but out of the emergency that was.
Yes, COVID. the early waves.
Yeah, and we saw really, really bad statistics about the impact of COVID specifically. We'll say on the Black community, right?
Sure.
And what's interesting is after that, so life expectancy is a great example. After that, things got better, but now they're kind of going backwards. And that's just with kind of racial equity. A great way to think about this is just the financial side of it. Like if you just think about the financial side of it, the haves and the have-nots, a lot of the other predictions, when we go through this, when we present this, and we'll present the Copernican consumer, right? And we'll talk about this almost nirvana-like state where you have all this health coming to you and it's all in your watch and it's beautiful. And then people are like, but not everybody can afford that. And you're like, you're right.
Yeah.
Not everybody can afford this watch that I'm wearing, right? Which was something you might need.
It's a very nice watch.
Thank you. To receive the Copernican consumer effect, right?
Right.
And that is not getting better. We know that the number one cause of bankruptcy in this country is medical costs, medical debt.
Yes.
That's just, sometimes you just wake up in the middle of the night and go, how are we all okay with this? It's ugly, and it's only going to get worse because there are major dynamics at play. Global warming, whether you believe it or not, it's happening. It's impacting us. And so heat is a perfect example. The people that are most vulnerable are the ones that are also going to suffer the most from increased heat, from the the rising shorelines, all of it. So this is not getting better. And there's other things going on right now that aren't necessarily helping the idea of health equity, because even the word equity now has become a lightning rod again.
It has, and coming out, it's funny you mentioned 2021 because you felt like every virtual or when physical conferences came back, there were speakers on equity. We actually had someone on this very podcast, Dr. David Lebarski, who's the CEO of UC Davis. He talked about climate change and how it affects healthcare.
Yeah.
No one was talking about that. It wasn't in our data. No one was our clients weren't asking their own questions. And then on equity, we're still writing about this in a lot of our publications about some of those disparities that continue. A basic one that cuts across all lines of gender, race, geographic location, age is the deferment of care. So we still see about 25% of consumers putting off necessary medical treatment due to perceived costs. I can't afford it. I can't take off work or get childcare. And that number in 2021 was about 28%. It's only dropped 3% in 3 years. We've got 1 in 4 Americans. Do we have hope in the next 5 years that we can close the gap? So it's not a lightning rod anymore. There's not a conference where someone's talking about it in that way like there was 2 or 3 years ago. But is there quietly work being done? Is there hope for work being done before 2030?
I mean, everybody's trying to do something, even in today where there's been backlash to things like DEI and but people are still trying to solve for this. But in the book, we talk about how it's so pervasive and so deep that it's going to take what we call some kind of moonshot, and a real moonshot, like putting somebody on the moon to really affect this in the right way. Because you can't have like a health system here and a health system there trying to tackle it. You can't have this state trying to do it or this city trying to do it. We're all going to have to band together. And I don't see that happening in the next 5 years. Like, who knows? But that requires the will of our society. And that's part of the point we make in this prediction is one of the experts that we talked to is from Europe. And he said, look, a healthcare system is reflective of the society, for good or for bad, that it's from. And our society treasures things like individualism, bootstrap, like you're on your own, like do it yourself. And so there's a wide swath of people that don't even believe people should have a right to healthcare. So until we're able to overcome some basic things like that, can you imagine right now, Ryan, us trying to move to something like Medicare for all? Yeah. Some kind of socialized medicine. There's just no way. Right. But other than and it doesn't have to be either of those solutions, but other than something at that level, I'll tell you what's scary, and then we'll leave with the most scary thing. This is a couple years ago now.
Up to it.
This is a couple years ago now. I think most people who work at the health systems know you want commercially insured people, then you want Medicare, then you want Medicaid, and the last people you want are self-pay, right? Because they're very hard to. Somebody comes in for $100,000 surgery, it's very hard to get them to pay. People don't have the money. So you're having to chase that money and it turns into bad debt. Okay. So that's what it's called at health systems, right? So basically they have to write off oftentimes all of this revenue that they've basically delivered these services, but they can't collect. And forever it was self-pay that was the worst. Now the number one source of bad debt are commercially insured patients, which is just stunning. Until you stop and think and you go back to constricted consumerism. Oh, yeah, that's right. People have $10,000 deductible.
They're empowered.
Most people, what's the stat? Like 50% of people in America could not afford a $400 emergency outlet,
that was
right?
a famous article, yes.
So if you have a $10,000 deductible, you're not paying for that. And
what are the
commercially insured. So it's not going the right direction, I'm sorry to say. We're ending on a really ugly note. But
I can maybe pull us out of this. I'll try.
We got another speed round. Dogs or cats?
Did you already answer that? So excellent job of going through. I think you hit society level changes, industry level changes, and then changes inside organizations. You're obviously continuing to talk about these predictions as we go through this decade to 2030. It will be fascinating to check back in another couple of years as well. We'll always have you back on as another repeat guest of this podcast. But you also have an event. You're going to bring some things together and talk about these in person. Do you want to say a little bit about that event?
It's ironically called the Joe Public Retreat.
Well titled. Good branding.
Yes. It's in a couple months, assuming this comes out in October. I think this is coming out in October, so it'll be in December. It's something we've done for a decade, and we bring together no more than 50 marketing leaders from the health system space. And that's intentional because this isn't a shushment. It's not a big conference. There's not a bunch of presentations. In fact, we don't allow any kind of PowerPoint or keynotes. It's all just conversation for 2.5 days around those issues that are most relevant to the marketing leaders at health system. And our topic this year is something we've been talking about. I think even with you, Ryan, we've talked about it on this show for the past year, and that's called Rome is Burning, which is essentially growing threats to the CMO position in the health system space. There's a lot to that. Time for another show. Maybe we can catch up on that. But we've got somebody come in and talk about AI.
Sure.
We have somebody come in and talk about the economics of healthcare and how those aren't necessarily, going in favor of somebody who would want to support marketing. We have somebody who's come in and talk about how the CMO role is changing outside of healthcare. So you have great panelists. It's a great conversation. Great time. And you're going to be there.
I will be there, and we will link to this in the episode description as well. But I want to squeeze in one more question.
Okay.
Maybe the most lighthearted. It's really up to you.
Okay.
And I'm trying to ask this of every guest this year. Day one in healthcare, you run into someone in an elevator, short ride, and picture them with their backpack on. They're in their first day in this industry that you've been in and understand so much about, but they're starting day one in healthcare.
Yeah.
What is a little piece of elevator ride advice you would give them?
What are they? Anything? They could be a nurse. They could be a CEO.
Yeah.
Could be anything.
Just
One piece of
person.
advice. No matter what you do, just remember to always fight for the person you're caring for the patient. It doesn't matter where you're coming from. Try to always keep that in mind.
I think
if I was in a bad place, I'd say, because it'll be really easy to lose that on day two.
If you had just talked about the 5 predictions, then you might be in a bad place. No, this was great. I appreciate your candor, transparency, and just revisiting all 5 of these with you a few years since you wrote about them, and we'll continue to do so. And I just want to thank you for being on the Patient No Longer podcast.
Thanks for having me back.
All right.
See you next time.
See you next time.